One of the most obvious lessons to come from the pandemic is that issues of health do not impact all Coloradans equally. The disparities impacting communities of color in Colorado were clear. Victoria De Leon looks at how lessons learned might create improvements.
We've seen vaccine clinics in unusual places this year. Churches, parking lots, flea markets, and despite the challenges that come with them,
getting people to sign up is a challenge.
Stacy Zuniga with the Latino Coalition of Weld County says they work. Stacy helped organize dozens of vaccine clinics, mostly in rural parts of Colorado.
I think it's important that we come to them.
The pandemic brought lessons with it about how to better reach underserved areas.
If we approach healthcare as equality and looking at how can we provide everything to everyone in the same manner, we're going to have the same outcomes that we had here, where we see more and higher devastating consequences to communities of color.
Instead, Dr. Ozzie Granardo says health systems need to approach healthcare through an equity lens. Dr. Granardo says the practices of meeting people where they are, sharing information in different languages, and going into communities to share information should continue beyond the pandemic.
That thought process really needs to continue for the next several decades. And until we get better at addressing some of the social determinants of health and/or addressing, for instance, racism in medicine, or at least the health disparities that we have in medicine.
All year, community organizations and health systems have worked hand in hand to take care of hard-to-reach areas and people. That includes communities with transportation, language, time, and even misinformation barriers.
There's so many things that were intertwined that we now see need to continue.
And so I think we've learned some lessons, some important lessons, and now we need to put those lessons into practice.
And so another way to address transportation barriers specifically is telehealth. Dr. Granardo said before the pandemic, it wasn't a common thing, and now online services make up half of his practice. And it's those kinds of things, Kyle, that are about meeting the needs of different people. So one thing he and Stacy both said is that misinformation continues to be the biggest barrier that they are still working on overcoming. So those lessons still to come.
I guess maybe on the plus side, Victoria, misinformation is a problem that you can fight, 7 days a week, 365 days a year, whether there's a pandemic or not. That can be an ongoing conversation with communities about how to find good information from trusted sources.
Yeah, absolutely. And now it's kind of as simple as, calling out that misinformation. So the community organizations, when they are scrolling down Facebook this time around and they see something that's not right, they call it out and make their own post. And that's kind of, where we are right now. That's
very interesting. Real time, like fact checking from people that they trust who are outside the news media. Very cool. We'll take all the help we can get. Thank you, Victoria.